There is rule of nines that is used to estimate the volume of fluid loss from burns, amount of skin that was damaged. For example, in adults, head and neck make approximately 9% of the body. Each arm also makes 9% and each leg 18%. Genitalia make 1% and trunk 36%. Degree of severity of burns. First degree burn happens very often from just sunburn. It shows redness, it can be some swelling and some pain, but there are no blisters and it disappears pretty soon. Second degree, it's as soon as blisters show up. So we have not just epidermis, but right now a part of the dermis, upper dermal damage with blisters. Third degree burn, it's when damage goes all the way through the skin. So practically skin right here is gone. You can see underlying tissues, muscles. The surface can be either red or sometimes black or gray-white. And initially there will be not too much pain. It's amazing. But because all the nerve endings are destroyed, pain shows up later. And in most of the cases, skin grafting is necessary. Such a skin which is, those tissues that are exposed very easily can get bacteria and develop infection. And finally, fourth degree burns. That's when underlying muscles and bones also will be burned. It's a very dangerous condition. Finally, bed sores, decubitus ulcers. They are caused by constant pressure on certain body parts. If you pressure on some certain body part, that will reduce amount of blood circulating in that area, and cells, tissues right there in that area do not receive enough of oxygen and nutrients, and they just simply start dying. Most common it happens in old patients that have conditions that cause them to be immobile, stay in bed, and prevention for those bed sores is much easier than treating them. So turning patients every few hours is necessary in cases of their immobility. If left untreated, bed sores can be fatal because they can become infected and the whole body will be infected there.